Good morning friends, welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Don't forget to subscribe my channel and also please give your valuable comments. So we were discussing about infections control in Ayurveda, and in the first class we have seen some of the introduction, and today also we will have the content portion of the same followed by the actual topic of infectious control guidelines in Ayurveda. Now sterilization, we know that sterilization is one of the important method for the infectious control. That means infectious agent control. Okay, so sterilization can be achieved by autoclaving or washing the hand, boiling, using some of the lotions, antiseptic lotions, etc., sanitization, etc. Then reservoir control can be done by the early diagnosis and early treatment to break the chain of transmission, to study the time of transmission, then gender involvement, then age, place and person distribution, to start the preventable measures and the treatment. Notification should be informed to local health authority. So these are the different steps in the infection control. Yes, this particular disease is now becoming deadly to the public, so it should be notified. Yes, you have to take care of this disease. Now this is a time for the breeding of this particular mosquitoes. This particular disease is mostly expected, so you have to notify these things to the local public and also local health authority in prior, so that they can take the necessary steps. Now another is investigations. So epidemiological investigations, we call it as the outbreak investigation helps to identify the source of infections, factor influencing the spread. Okay, now these factors include the geographical situations, like some of the infections are common in the mountain area, some of the infections are common in the coastal area, etc. Or climatic conditions. Sometimes the infection is common in the rainy season, sometimes in the winter season, or sometimes in between rain and winter, and sometime in the summer, late summer, early summer. So like that, the climatic conditions. Then social and behavioral pattern. That means this disease is more common in which particular population group. For example, the smokers, it is common. This particular disease is because of some of the problem in the eating habits, and this is because some of the problem in the sleep pattern, or this is because of the lack of hygiene. So social and behavioral pattern of that particular disease has to be explained. Apart from that, the character of the agent, character of the reservoir, vector and vehicles, and also the susceptible host population. Sometimes agent may be very virulent, sometimes the virus or agent may be less virulent, bacteria may be more virulent. Okay, sometimes the reservoir may be human, or sometimes it may be flies, sometimes it may be animals. Okay, sometimes of course it is unidentified. Then you have to think about the vectors. The vectors, flies, housefly, sandfly, and many things. Then vehicles, maybe through the water, through the food, or maybe through the milk, etc. So these factors has to be understood, and it should be priorly intimated to the health authority. Another is isolation. One more disease control measure which is commonly followed is isolation. Knowing all these things is very important to understand the Ayurvedic standards of guidelines. Now, separation of the individual or any animal, etc., till the period of communicability in such places. That means you have to separate the individual animal from the reservoir, some other sources or other sources of infection, till the completion of period of communicability or a period of infectability in such places, under such conditions, so as to prevent or limit the direct and indirect transmission of the infectious agent from infected susceptible infected person. That is called as isolation. The duration of the isolation depends upon the duration of the communicability or the effect of chemotherapy, how many days actually chemotherapy helps to produce the effects. Then suppose if you talk about chickenpox, the isolation should be done until all the lesions are get crusted. Once it get crusted, so its infectivity period, in communicable period will be over. Usually about 6 days after the onset of the rash. So like this, for the different infections, we have got different period of communicability and infectability. Another commonly used word in case of isolation is quarantine. Quarantine, we oftenly the word became very popular during the COVID time. The quarantine is defined as the limitation of a freedom of movement of such well person or domestic animal which is exposed to the communicable disease. The limitation of freedom of movement, that means a person is not allowed to move here and there. There is a limitation for his freedom of movement. A normal person, okay, normal person, he is now quarantined, means his movement has been restricted. Okay, maybe the man or maybe the animal which is already exposed to the communicable disease. Already he is exposed to the communicable disease. So we have seen in the COVID times many who are coming from the abroad, so they have been quarantined because there they are already exposed to the communicable disease for a period of time not longer than the longest usual incubation period of the disease, in such a manner so as to effective contact with the those not get exposed. So this is the definition of a quarantine. Now, control of transmission. So how you can control the transmission? Transmission can be controlled by the change in the environment. Means changing some components of man's environment to prevent the infective agent from a patient to carrier from entering into the body susceptible person. Like, for example, chlorination of the water. Now, when I say change in the environment means many meanings are there. Okay, one is you can get into the infection environmental control, or now for example chlorination of the water treatment will prevent the waterborne disease. Similarly, boiling the milk, compulsorily boiling the milk before usage, so that prevents the milk-borne. Then the food safety, so that decreases the foodborne infections. So like that, control of transmission by the environmental control means you're changing the environment. Okay, so another is the control of the vector. So vector control can be achieved by means of repellents or disinfectants, and the disinfectants for the flies, mosquitoes, or fogging, etc. So that's about the vector control. Or vector control can be also achieved by not allowing the water to get stagnate. Okay, so the cleaning the coolers and like that. So the prevention of the accumulation of the stagnant water, especially in the rainy season. So that's one of the important issue. Now, personal hygiene, infection control can be also achieved by the personal hygiene. So this is one's own, keeping clean and neat and disinfectant, and spraying so many disinfectant solutions, etc., or cleaning the floor of the home by the Dettol and so many other disinfectant solutions, phenol, etc. Now, so these are some of the important aspects in the disease control. So the next class onwards we will discuss about Ayurveda guidelines for the understanding of infectious disease control. What are the different aspects which are covered in Ayurveda regarding infections control? Mainly we are focusing on the management of the Graha Rogas, which is explained in Kaumabhritya, because we already completed the class regarding the basic introduction of Graha Rogas, where we have successfully proved that the Graha Rogas can be compared with the infectious disorders. Okay, different types of infectious disorders. So now when we talk about management of this Graha Roga, it is nothing but the management of the infectious disorders, that is infection control. So that we will start from next class onwards. Thank you very much.